this video, we are going to see about case study on stereotactic radiography. What is stereotactic radiography? It is a surgery procedure which is to be held at the brain, right? Next. Okay. What is stereotactic radiography? Stereotactic radiography is a very precise form of therapeutic radiation that can be used to treat abnormalities in the brain and the spine. Right? Stereotactic radiography is a very precise form of therapeutic radiation. It is a type of therapy, right? Therapeutic radiation that can be used to treat abnormalities in the brain and the spine, including cancer, epilepsies, trigeminal and arteriovenous malformation. Arterial venous malformation. It is also used to treat the abnormalities in brain and spine, including cancer, epilepsy and arteriovenular malformation. Okay, the term stereotactic refers to the use of three-dimensional coordinate system. It is a three-dimensional coordinate system combined with an imaging techniques. It is a three-dimensional. Will be measuring in all the dimensions. Three-dimensional coordinate system combined with an imaging technique such as computer tomography scanning or magnetic resonance scanning, whereas CT and MRI, to precisely locate target deeply within the brains. Since this is specially for brain and spine abnormalities, we can use the CT scan and or the MRI scans to precisely locate the targets deeply with the brain. Okay, stereotactic radiography is a very precise form of therapeutic radiation that can be used for the to treat the abnormalities in the brain and spine, and even it is used for identifying cancers, epilepsies. Okay. This is a stereotactic surgery. How the surgery takes place. This image shows that how the stereotactic surgery takes places. Okay, here is the procedure. How the stereotactic procedure takes place. A stereotactic brain surgery is a surgical procedure. Where lesions, frequently a brain tumor, is removed with assistance of image guidance. Okay, the stereotactic brain surgery is a surgical procedure where lesions, frequently a brain tumors is removed. Lesions and frequently brain tumors are removed with assist of image guidance. Okay, that is previously obtained images used to guide the surgery to extract location of the lesion to facilitates as accurate a pathway through the brain and safe. Okay, where we have the image guidance before itself. By using that, the surgeon will be guided to guide the surgery, to guide how the surgery to be undertaken. Okay, stereotactic surgery is based on the Cartesian coordinate system. Okay, which implies that any point in space may be determined by three right-angled planes. Okay, stereotactic surgery is based on the Cartesian coordinate system, which implies that any point in the space may determine three right angled planes defined as x, y and z axis. Okay, which is defined as x, y and z axis. Okay, block diagram. This is the block diagram for stereotactic surgery system. How does the surgery has been undertaken in the brain? Okay, we have capillaries, rings, holders and stereo microscope, injections, stereotactic frames, which is used to look at the brain, look at the images which is to be operated, right? Anesthesia system and all these are given in the block diagram of stereotactic radiography. Working. How does the stereotactic surgery takes place and works? All types of stereotactic radiosurgery and radiotherapy works in a similar way. Radiosurgery and radiotherapy both works in the similar way. The specialized equipments focuses many small beams of radiation on the tumors or other targets. Okay, the specialized equipment specially focuses on the small beams. Since we are going to operate in the brain, we are not supposed to give a large amount of radiation in the brain. Why? Because since the brain is a very sensitive organ, the cells will get damaged very easily. So what we are going to do is that we'll mainly focus on the small beams to be radiated on the tumors which is present at the brain. Okay, each beam has very little effect on the tissue it passes through. As I told you already, the brain, beams which are passed through the tissue will have a very little amount of effect. But a targeted dose of radiation is delivered to the site where all the beams intersect. Where we are going to target where the tissues to be operated, that target will be given a larger dosage while comparing to the other areas surrounded, other cells which is surrounded other than the targeted image. Okay, the high dose of radiations delivered to the affected area causes tumors to shrink and blood vessels to close off over time following treatments. Okay, while the high dosage of radiation is passed to the tumor cells, the cell will be shrinked and the blood vessels will be closed off for a period of time, robbing the tumor of its blood supply. The blood supply will be cut off and the tumors will be removed. Okay.